Hi, I am Dr. Felice Gersh, your integrative OBGYN physician. And today we're going to talk about a topic that I am just burning to talk about. It's about growth factors. Now you may say, what the heck? What do growth factors matter? What are they about? Well, it comes into play in everything I believe in and the way I prescribe and urge others to prescribe hormones for women who are in the menopause. So let's go back, take a step back. I've said this over and over. The prime directive of life is the creation of new life. Now, I always say this as well. I want women to have babies when and if they want them. But if you're going to be healthiest, you're going to live your optimal life as a woman, you need to understand how the female body evolved. And if you're a physician or other healthcare practitioner and you take care of women, you too need to know, because if you prescribe hormones in ways that are not aligned with the way the human female body evolved to work properly, then you are not helping matters. You may think you are, but you are not. And if you're the patient, you're not getting the best care, even though the prescriber wants to do the right thing, but just doesn't realize that what they're prescribing is not the optimal prescribing way. So back to growth factors and talking about creation of life. In order to create a new life, you need so many complex things to happen perfectly. It's so amazing. It's really mind-boggling. And in order for this to happen, in order for there to be ovulation, in order for there to be an ovary that grows cellular structures that support an egg, that supports the pregnancy in the early stages before the placenta is developed, in order to have everything go right, in order for the embryo at just the right developmental stage to enter into the uterus, and then miracles of all miracles, it implants into the uterine wall and then is nurtured, and all these other structures are made to support the developing fetus, the placenta, the membranes, everything. It's the most incredible dance between the embryological tissues and the maternal tissues. And to that end, you need to have optimal hormones. I'm sure everyone in there who's ever been on a fertility journey knows you need to have optimal hormones. And what do these hormones do? Well, all the things I just mentioned, including facilitate the implantation process, which is so amazing and complex. If you look at the way the embryo gets into the uterine wall, it's like the parting of the Red Sea, the way the swirls of the muscle tissue, the myometrium, like separate and move apart, and the embryo comes in. It requires a tremendous amount of varied types of growth factors. Okay, back to growth factors. I'm getting back to the topic, but in order to understand what happens in menopause and the link that it has to all the other issues that we're talking about is really important, because everything in life is connected and a continuum. So, in order for pregnancy to occur, you need to have all of these different growth factors. Now, what the heck is causing these growth factors? Where are they coming from? And I'm going to talk a little bit about what these growth factors are. I'm going to give you some names of growth factors. And as you can guess from the name growth factors, they have something to do with growth, right? So we'll talk about that. And it goes way beyond just the word growth, but that's sort of in there. Okay, so when you have one system in the body, like in the uterus, and creation of a new life, implantation of an embryo, all the things that preceded in the ovaries and the fallopian tube and so on. And you need these elaborate multiple types of growth factors that are made by the ovarian tissues, the uterine tissues, but then all the systems in the body are replicated. And a lot of people don't know this. Everything is replicated. The renin-angiotensin-aldosterone system that I've talked about and published papers on, which regulates the inflammatory pathways and then ultimately, in terms of high blood pressure, is regulating whether arteries are constricted or relaxed. That whole system, which most people like in internal medicine and cardiology have no idea, that entire system, the renin-angiotensin-aldosterone system, is replicated in the female reproductive tissues. Everything is replicated. In the female tissues, there are these other types of hormone type, like chemicals called endocannabinoids. And estradiol increases their production and progesterone decreases their production. That system is also replicated in many other organ systems of the body. And most people know they're in the brain because that's where anandamide, which is the analogous endocannabinoid, activates the endocannabinoid receptors. That's what THC binds to, which is, of course, from cannabis. But that binds to our own receptors. But the reason I'm bringing that up is for you to understand that all the systems that are working in the uterus and involved in the ovary related to reproductive success are replicated elsewhere in the body. And that's where there's a lot of duplication. Once you learn about growth factors, you see how they're the same growth factors that are elsewhere, that are involved in pregnancy, creation, and elsewhere in the body. Now, in pregnancy and trying to create a pregnancy, what is the control of those growth factors? Drum roll, please. It's estrogen, but also progesterone, okay? So knowing that will help you to understand why growth factors matter and why these wonderful life hormones, I don't call them sex hormones anymore, these wonderful life hormones are so essential to be given in the right amount and in the right rhythms to regulate these growth factors, okay? Now, let's talk about growth factors elsewhere in the body that are modulated or controlled in terms of their production and how they work by estradiol and progesterone. So let's talk about what growth factors do in the body. They're involved in cell growth, repair, overall health. So in terms of repair, if you have an injured tissue or dead tissue, you have to do something with it. Well, you want to have your immune system gobble up dead tissue or damaged tissue, and then you have to replace it. You have to repair the injured tissue. That requires growth factors. So growth factors are important for the repair, for the growth, for the rejuvenation, for the replenishment of cells and tissues in the body. So this is really important. If you didn't have growth factors, you couldn't repair anything. You couldn't fix anything. Like wounds. If you had a wound on your arm, how are you going to fix it? You have to have growth factors. You can't fix it without growth factors. In fact, you may know this. Old people, if they have a wound, wherever it is, I'm just pointing to my arm, a wound doesn't heal well in old people generally, or it heals much slower. And that's because estradiol is actually produced in the skin in men. It can be in women, but it's made from testosterone. The enzyme aromatase is in the skin, and men tend to have lower testosterone as they age. But women don't have enough testosterone, and women don't have the estradiol that they need to create the growth factors to heal the wound. In fact, there's published data that if you take estradiol and apply it to a wound, you will have faster, better healing, okay? Estradiol on the skin, with the skin, helps maintain all the skin structures. It helps maintain elastin and collagen. It helps repair injured tissue. It's anti-cancer. So just on the skin alone, estradiol, with its production and modulation of growth factors, is critically important. Now, what about other areas like tissue regeneration? So you have to sometimes create new blood vessels. So we have growth factors for creating new tissue, and that includes new blood vessels. Now, in the brain, you want to maintain and repair your neurons. So there are growth factors for doing that as well. Now, we have growth factors that are heavily involved in the immune system as well, that are all modulated by estradiol and progesterone. I'm going to go into that in a minute, has a significant role as well. Once you start learning about reproduction and you see the critical nature of growth factors for all the facets of creating a new life, then you can see how these growth factors under the control of estradiol and progesterone everywhere in the body, in every single organ system, are critical. In terms of the immune system, the immune cells themselves create growth factors, including growth factors that are under the name of cytokines. And cytokines, they're very interesting. Some of them are also like anti-growth factors. They induce cell death, what we call apoptosis. Sometimes bad cells need to be killed off. Estradiol controls when yucky cells die and kill themselves. So it's growth factors that grow, repair, nurture, rejuvenate, and also the sort of anti-growth factors that induce cell death, or what we call apoptosis, programmed cell suicide. Now, all of this requires the right amount of estradiol. It's not enough to have just any. In fact, if you look at the menstrual cycle, during the first half of the menstrual cycle, which is called the proliferative phase, proliferative as in proliferate, you're growing, you're literally growing the uterine lining. And that requires a growing amount of estradiol produced. At the very beginning of the menstrual cycle, that is when you're shedding like day one of the menstrual cycle is the first day of bleeding. Then your estradiol level and progesterone is at its rock bottom level. And only as the estradiol increases does the uterine lining grow or proliferate until it gets quite thick. And of course, in infertility clinics, they're measuring that thickness, the growth of it, with ultrasound. And then after ovulation, the progesterone comes on board, and progesterone downregulates the receptors called alpha that estrogen promotes, which are involved in growth. Okay, so progesterone stops the growth of the uterine lining, and then it becomes secretory, or like blossoms and blooms. So you have this beautiful duet between estradiol and progesterone. And progesterone modulates these growth factors so that they are not like too much. So think of it as a little simplistic, but like the brakes, that's progesterone, estrogen, that's like the gas pedal, okay? Granted, that's simplistic, but it kind of helps you to understand. Now, this has been really important in that, for reasons that I have my theories, I'm not going to go into them right now, why this has become the standard, but not with good science, okay? I think for simplicity. But let me tell you, sorry, don't kill the messenger. The female body is not simple. It's complex, but we should love it for its complexity, okay? And not try to dummy it down by giving a dummied down modality of hormone therapy, okay? That makes no sense. Now, I made a list of some of the growth factors, and if you're interested, you can go and look these up. This is not a comprehensive list, okay? So I wrote some down here. Let me just read this. Bone morphogenic protein, fibroblast growth factor, transforming growth factor beta, there's also alpha, the neurotropics, and this includes things like brain-derived neurotrophic factor, nerve growth factor, and others, colony stimulating factors. Now, they're families. A lot of these growth factors are families of growth factors, so there's multiples within these families of growth factors. There's like platelet-derived growth factor, but it's not one growth factor, it's a family of growth factors. Erythropoietin, thrombopoietin, myostatin, epidermal growth factors. It's not one, there's a family of these. Hepatocyte growth factors. There's growth factors for cartilage, for the intestinal lining cells. There's vascular endothelial growth factor. You can guess what, and there's factors, there are families of growth factors. Vascular, of course, making new vessels. There's insulin-like growth factors, and that's not just one. There's type 1, type 2. They're a family as well. And then there are growth factors that work on cell migration and axon guidance. There are the whole family that are involved, that are more complex in blood vessel development. And then in terms of like the immune cells, they involve the interleukins and the cytokines, which are signaling agents. And if you talk about, I know a lot of people are into some of these other kinds of treatments, okay? Like alternative treatments and so on, peptides. I'm sure many of you have heard of peptides. Well, I did a deep dive, and every time I heard of a peptide, I went to look at, well, what's the trigger? Many peptides are types of growth factors, okay? So I went and I did a deep dive, and every time I heard of a new peptide, I looked it up, and guess what? They're under the control of estrogen. Okay, so if you have adequate hormones, you shouldn't ever even need to take peptides because they're under the auspices of estradiol and then modulated by progesterone. So like even GLP-1s, which is what people are taking to deal with weight, to have weight loss. I knew this right from the get-go. I said, if you go on those drugs, you will definitely do better if you have estrogen on board. Why is that? Because estradiol modulates this is, of course, in the family of medications that are controlled by estradiol. I look up everything under the auspices of estradiol with progesterone sort of modulating. So it's really important to know this. You want a good brain? You want nerve growth factor, brain-derived growth factor? It takes an adequate amount of estradiol. Remember, the tiny bit of estradiol that's present in the earliest phase of the menstrual cycle is not even enough to grow the uterine lining to any substantial amount. You have to have more estradiol. You need more estradiol to make bone, to make neurons, to support neurons, to grow skin. Everything is dose related, and a lot of that is because the dose relates to the production of growth factors, these vital molecules that control cell function and cell survival, cell health, which means your health, okay? Now, when you look at some of the most common hormone regimens, and how could they possibly have come into being? Well, if we go back, way back at the beginning when hormones were first prescribed, the way they were given were first, women would be on Premarin, that's conjugated equine estrogen, and they would take one pill a day, typically 1.25 milligrams. That's what it was in the first early days. And then they dropped it and recommended a lower dose based on blood clotting, because Premarin increases blood clotting. We knew that way back, to 0.625 milligrams. And then you would take, at that time, they would give 10 or 12 days of medroxyprogesterone acetate to create a period. So basically, the first rendition of hormone therapy was cyclic. But then later, the company developed Prem-Pro, which was a combination of the Premarin, the conjugated equine estrogens, and Provera, the brand name for medroxyprogesterone acetate. Now, medroxyprogesterone acetate is a really strong fake progesterone in terms of its binding and action on the uterine lining. So it's like supercharged progesterone. Remember, I told you progesterone downregulates the growth factors of estradiol. So this is why the uterine lining doesn't keep growing after progesterone comes on the scene in the luteal phase or the secretory phase, the second half of the menstrual cycle. So progesterone is so weak compared to medroxyprogesterone acetate, like molecule to molecule on the uterine lining. So there was still a lot of breakthrough bleeding. But the goal back in the day when that first came on was not to make women healthy. Okay? It's really important to know that. It was simply to prevent or resolve night sweats and hot flashes. But this is decades ago. We've come a long way from then. We understand so much more about what these hormones do, not these like non-human hormones or hormone mimics and horse urine hormones and all that, but real identical to human produced hormones, estradiol and progesterone. So this is really important. We didn't know that back in the day. But even after that, when they started doing studies, it became much more common to go back to cyclic. So the KEEP study and the ELITE study both used cyclic hormones, which would create a pretend but real blood period. By the way, nobody thought it was horrible. Nobody said no woman could do this. It was just the way it was. Women just knew they're females. If you take hormones, you will bleed. You won't be fertile in menopause, but you will have like blood, as if it were a period. But then we had all the fear that came on board, and then we had the proliferation of a variety of online prescribing things. And what became more commonplace was a very tiny dose of estradiol, so little that when they do studies, often the amount that's generated is still in the menopausal blood range. So remember, if you keep it in the menopausal range, it shouldn't grow the uterine lining. So that would be a level below 50 picograms per mil. But interestingly enough, even at a level below 50, there is typically reduction of night sweats and hot flashes, although it may take a while. So that's like a fascinating thing that you can suppress reasonably night sweats and hot flashes, even with a very suboptimal, very low amount of estradiol, staying in the menopausal range. In fact, in the KEEP study, they even wrote in that study, I'm not going to go into those studies right now, but these were studies that came out after the Women's Health Initiative. They even wrote they were influenced by the Women's Health Initiative and kept their doses very low. So they kept their doses to the point where the highest level they got of the estradiol in the blood was 40 picograms per mil. And that is in the menopausal range. We know from studies that if you don't get the estradiol level above 50, you don't even have any benefit for the genitourinary system. The vaginal and bladder tissues are not going to be improved if you keep the dose really low. Now, let's think about the kind of doses that people are getting so commonly now of estradiol. If you measure, by the way, it's not even encouraged to measure the level. All that's said is, do you now have hot flashes or night sweats? And if the answer is no, then it's like case closed. You have met the goal. Well, it depends on what your goal is. If it's optimization of growth factors so that you can have repair, rejuvenation, maintenance of all of your organ systems, and not just all of that, but also have proper programmed self-suicide and many other things that estradiol does beyond what I'm telling you with growth factors and what you might call anti-growth factors that cause dead, yucky cells to be eliminated, or cells that should be dead to be made to be dead. And that's really important too, because cells that don't die become ongoing senescent cells, or what they call zombie cells, that can turn into cancer and create lots of systemic inflammation, which is terrible for us. So we definitely don't want that. But none of this is going to be right when you keep the estradiol level so low. Now, why would they make it so that you would get such a low estradiol level? Why are so many doctors and clinics prescribing estradiol at such a low level? Because they are under the belief that, number one, no woman will accept bleeding after menopause. And also they say things so ridiculous like, well, it's not natural. Duh, do I not know it's not natural? You know what natural is? Shriveling up, having fractures, dementia, hypertension, heart attacks, strokes, wrinkles. You want that? You can have it. That's called natural. Taking any hormones after menopause isn't natural, and nothing in medicine is natural. Replacing a joint isn't natural. Having your cataracts replaced with good lenses is not natural. No drug is natural. So don't go there with me about natural. My goal is optimization, whatever that takes, as long as it doesn't harm anybody else or the planet. Okay. So I want optimization, not natural, but I want to do it in a way that's aligned with the natural body. Like food. I don't want ultra processed food. I want real, natural, organic food. I don't want some fake, crazy hormone regimen. I want a hormone regimen that's aligned with the way the female body evolved for optimal function. Okay. So dose matters. The reason that they give every woman now at most clinics this tiny amount of estradiol is to prevent growth factors in the uterine lining, because the uterus is part of the body. I started off by explaining a little bit about growth factors and fertility. So if you have estradiol, it will do its thing in the uterus, while it's also doing its thing in the brain, in the bone, in the skin, in the arteries, everywhere, okay, in the joints, you name it, okay, in the GI tract. So you will make growth factors appropriately everywhere in a controlled fashion. Now, remember, you also need progesterone. The progesterone has to act as kind of like the brakes. So you need this rhythm. First you grow, then you pause, then you shed. Growth, pause, and shed. And during the pause, all kinds of interesting things are happening. It's not just you're put in static, hibernation. Like interesting things are happening during that so-called static that I just said, or the pause, that you stop growing, but you are flourishing. Things are happening in a way that are essential for cellular health and function, just like in the uterine lining. These systems are replicated everywhere in the body. So, in order to get proper growth factors, you need the proper dose of estradiol. You will grow uterine lining. That's just what it is. If you have enough growth factors to get the adequate amount of brain-derived neurotrophic factor, nerve growth factor, vascular endothelial growth factors, epidermal growth factors, on, all these incredibly important growth factors, they're dose related. And they will do the thing that they're programmed to do, which is also grow the uterine lining. Now, if you grow the uterine lining and it just grows and grows and grows, but you don't have progesterone, eventually it will become unstable and start to randomly fall out. And that's just random bleeding. We can't have that happen. That is not appropriate. And there's always a small chance that over time it could even become overstimulated in someone who is particularly in an inflammatory state and even develop uterine cancer. So we give progesterone. So dose matters of progesterone too. You have to have the proper dose to have the proper conversion of the uterine lining to a secretory state. That's what we call it. It's like the blossoming state. And you need to have proper expulsion of the uterine lining in a clear, simple, expedient way so that you don't have prolonged bleeding, heavy bleeding. You need to have that lining become complete secretory transformation. That requires an adequate dose of progesterone. Now, the only way to get an adequate dose of progesterone to counter a physiologic level of estradiol is by not giving it orally. Okay, we can't give the progesterone by mouth because it goes through what we call first pass through the liver, where 80 to 90% of it is converted into other stuff, which I've talked about, but I'm not going to go into that right now, leaving a very small amount of progesterone. In a normal luteal phase of the menstrual cycle, when progesterone is made, the minimum amount that's considered adequate is 10. Okay? It has to be a number of 10. I won't even bother with the units, just no 10. Okay? And better even to be in the upper teens or even in the 20s. What kind of level do you get if you take oral progesterone like 100? Like 1.5, 2? And even at 200, what level do you get? Like 4? Could be 5, but usually more like 3 or 4. And you're getting all the other stuff that you don't want, the allopregnanolone. And this is not, it's enough. It's enough if the amount of estrogen is so tiny that there's almost no proliferation or growth. So what you're trying to do, if you give this tiny dose of estradiol every day, which is so classic now in what prescribers are doing, and then you give a dose of oral progesterone, typically 100, sometimes 200 every night, the goal of that isn't to make you optimally healthy. You need to know that. That is not the goal. It's to suppress night sweats and hot flashes. End of story. It is not to make you optimally healthy, because that particular regimen has zero science behind it to make you optimally healthy, and there's no clinical data either. There's some clinical data. We never have enough for anything, but there's definitely no clinical data to support it, that being optimally healthy, and there's no science behind it at all. Not even a teeny bit that is going to make you optimally healthy. You're not going to get optimal growth factors, no way, no how. The point of it is to suppress growth factors that are made by the estradiol, and to give such a tiny dose that you make almost no growth factors in the first place. So you won't bleed, but you also won't benefit. Not much. You can suppress night sweats and hot flashes, and you can even suppress some bone loss. I don't want to make it sound all doom and gloom. There are some benefits, and they're not insignificant. But here's some of the concerns. Not only do you not get optimal benefits, because you're certainly not making much in terms of growth factors that support all the organ systems, you're not making enough of the what you might call anti-growth factors that promote appropriate cell death. So you're not getting any of that optimally, but you're giving progesterone every day. So you're suppressing, not only you're not getting them, but you're even suppressing growth factors, because remember, progesterone is like the brakes, and it downregulates the estrogen receptor that creates growth factors, the alpha. You will suppress the growth factors that you could have made in your brain. You will suppress growth factors that you could have made elsewhere in the body, and nobody's even looking, okay? So there is some concern that if you are continuously on this regimen over a long haul period of time, maybe, we don't have proof of anything. We certainly don't have proof of not, but maybe this will long-term increase your risk of dementia. And then with oral progesterone, you're also getting too much allopregnanolone every night, which is also potentially reducing your ability to make and set memories. And we have rat data. I know it's not human data, but rat data that kind of a regimen could increase the risk of dementia. But it could definitely, and there's some data in humans, reduce memory formation. So, in summary, growth factors are essential for optimal cellular function, rejuvenation, repair, and overall body health. We need to have a functional immune system that has the proper production of the leukotrienes and the cytokines, and working to modulate growth and get rid of old tissue, create new tissue. All of that requires a functional immune system. You need to have these growth factors, of which there are so many kinds all over the body, that are doing all the critical maintenance work of the body. You can't be healthy if you don't have growth factors. So many people are running out and saying they want, growth hormone. Well, estradiol actually modulates growth hormone, okay? Everything involved in growth, restoration, and modulation of every cell is related to estradiol and progesterone as the grand modulator. And they work in this beautiful synergy and balance, which requires optimal dosing and optimal rhythm. So you don't want a tiny dose of estradiol, not enough to create adequate growth factors, combined with daily inadequate progesterone that's given orally, that is going to downregulate the little growth factors that your body is even trying to make from that little dose of estradiol, all for the purpose of what? So you don't bleed and you don't call up anybody and bother them. Except you're a beautiful female. Females evolved this way. You can't have optimal health with optimal growth factors that you need to sustain your organs and your tissues. You can't have that. And if you have a uterus, not grow the uterine lining. It's a package deal. So grow your uterine lining. It's not dangerous. By the way, some doctors, they don't have any knowledge of what you now know. They really don't have the teaching, the background. And they think any growth of the uterine lining is frightening and a sign of impending uterine cancer, endometrial adenocarcinoma. That is not the truth. If you give estradiol and it grows your uterine lining, it is growing tissue elsewhere through the growth factors. You're rejuvenating. Don't just think of growth, rejuvenating, repairing. And then when you give the progesterone for 2 weeks, you're modulating that growth in a very healthy way, as long as you give the right amount of progesterone, not orally, so that you can get optimal levels of progesterone, ideally vaginally, which has like a first pass through the uterine lining, which creates a complete secretory transformation, which makes the tissue perfect for shedding. It's not pro-cancer. Rhythmic hormones were the first hormones used. Rhythmic cyclic hormones were what were considered the way to treat women in menopause when treatment first began, when they added the progestin. Now, granted, the very first, I should have gone back, the very first was not with the cyclic, it was just with Premarin alone, okay? But when they added the progestin, it was cyclic, okay? So that was really second. Okay, but in the terms of when you had the two together, it was cyclic until Prempro came on the scene. So accept your femininity and accept the bleeding, not as a sign of annoyance, but a sign that the estrogen is working. If it's growing your uterine lining, it's growing and repairing and rejuvenating everywhere in your body. And if you have an ultrasound and it shows the uterine lining is growing, that is a sign that it's working. That's what it's supposed to do. If you have an ultrasound of your uterine cavity and you're not on estrogen and you're 60 years old and the uterine lining is growing or thickening, of course, that's abnormal. That's a problem. But if you're on optimal doses of hormones and your uterine lining grows, that's normal. And then you take the progesterone and then you bleed and you shed it, that's normal. If you bleed randomly and or irregularly, then you check it out, okay? But if you get the right levels, the right doses, everything is working and you have perfect periods, that is wonderful. Almost 100% of time, women who get uterine cancer have some kind of irregular bleeding. It's an early warning sign. Perfect regular cycles are almost never associated with uterine cancer. And if you feel so worried, get a uterine biopsy. It takes 3 minutes in the office. I've done them so many times I couldn't tell you. And then you have peace of mind. I don't want you to be a worrywart. If you have even the slightest doubt, just get the biopsy. So, growth factors are essential for optimal health. Estradiol creates them, modulates them. Progesterone also modulates them so that they're under control. It's a beautiful synergy, but you have to have the right doses and the right rhythms.